still require you to wear masks inside the offices. So I'm just here. I'm waiting on my nurse to come in and just kind of go over everything for the pre-op. And I'll definitely share that with you guys. Hey everyone. All right, so I have just wrapped up my my pre-op with my nurse, and I have a ton of information, an entire packet to read through, and so I'm gonna take the time and I'm gonna go through that with you guys, so stay tuned. Alright guys, so I compiled a list of questions to ask my nurse. I was told to do so by my patient coordinator, just so that, you know, I have all my bases covered. The good thing about my nurse is she was able to answer a lot of the questions that I had, so it wasn't really much that I needed to go over with her. So here it goes. My first question was, will it just be one surgeon performing the mommy makeover? And I was told yes. The reason I asked that is because in my previous research, I saw that facilities were having 2 and 3 surgeons performing, I guess, to kind of get the patient in and out the door, which is never really a good thing. So in my case, it's just going to be the one surgeon. Next was, I do have a C-section scar from my first baby, and I asked if that scar line would be used, and I was told yes. I asked what type of compression garment to get, and I was told to get this one, but I actually prefer this one. So I also asked if I would get, if I should get an abdominal lipo-compression board. I was told no, because it isn't really necessary, since the compression garment actually gives you enough compression. And the abdominal lipo compression board is really used if you're getting liposuction in the abdominal area, in the upper abdominal area. I asked when should I get a bra fitting. I believe she mentioned 3 to 6 weeks after surgery is a good time, given that, you know, I'm healing well and everything. I asked what type of bra should I wear following the procedure, and I was told just like a regular sports bra should be okay. So I need to remove all of my jewelry, right? I need to remove all of that. No jewelry at all on the day of surgery. So I did ask, like, how do I prepare for surgery the day before or the morning of? So the day before, basically, I already collected my medications. They call them my medications. It's called a scopolamine patch, and it's placed behind the ears. So the evening before my surgery, I need to go in and get my markings on my body. They're not going to be doing it on the morning of, because I have an early morning surgical. That's my appointment time. I believe it's around 11, but I need to get there early so that they go over, you know, just the waivers and all these different things. So the night before, I need to put that patch behind my ear. It lasts for 3 days. So what it does, it prevents nausea. So when I wake up from my procedure after the mommy makeover is done, I'm not nauseous due to all the anesthesia in my body. And I wear that for 3 days, and then I can take it off. Let's see. So the night before my surgery, I can eat up until midnight. The morning of my surgery, I cannot eat or drink anything. So that's that's going to be something. Most I can do is I can just brush my teeth. I can't consume food or water. I can't do any of that on the morning of my surgery. Right. My next question was, how should I lay down after surgery when I get home? So I was told So this position is actually structural for my back, for my legs, making sure that there's no strain on the abdominal area. So that position is actually pretty good. Next question was, are post-op massages recommended? Now, post-op massages, from everyone that I've seen, depending on if this person is, you know, they're certified in lymphatic massages. And yes, people have to be certified to perform a lymphatic massage. And basically what it does is it helps the body get rid of any excess fluid or anything that like that that would basically gather in the body where the drains, and I'll cover drains a little bit, where the drains are actually you know, not being able to get all that fluid out of your body, excess fluid, so you don't look so swollen, because you do look swollen following surgery. And I was told that they offer there's a place that they could send me where I get 2 complimentary ones, but if I want, I can pay for any extra. So I guess obviously depending on how those 2 go, I'll determine if I'll return at that location to book extra massages. So far, everyone who has had them done did mention that they help a great deal. They feel better. It helps minimize the pain that you receive in some area, because swelling can, you know, be associated with some type of, you know, pain, and you don't want to have swelling and pain at the same time. That's, you know, it should assist with all of that. So get your lymphatic massages after your surgery. All right. I did ask how to use the bathroom or the toilet after my surgery, and she laughed, and then she said, very gently. So basically what she advises that, you know, steer clear of any sort of foods that would, you know, build up too much in the body where I would have to, you know, force a poop or whatever that, you know, whatever causes you to get backed up. She basically mentioned getting high fiber foods or anything where, you know, I don't have to force, because when you have that scarring, you have stitches on the inside and the outside, and you don't want anything tearing. So she did mention starting some type of stool softener if I wanted, like from 3 days before, just so that my body kind of gets regular. So I may consider doing that. I did ask how soon I would be able to take a bath. She did indicate 72 hours after surgery I can take a bath. Just ensure that the surgical area doesn't get wet, and if it does get wet, it can be dried properly, and, you know, put, whether it's the silicone band-aid or whatever it is that promotes healing, right? I did ask what foods to avoid pre and post-op. With this type of surgery, I was told that there isn't really any dietary restrictions, so that's a good thing. But obviously, you know, they say just, you know, avoid like any, you know, fatty foods for like the first week, right? Just so that it helps your body to heal properly. And then I asked what type of clothing should I wear after surgery. She suggested loose clothing, like she suggested these cute little summer dresses where you can just pull on and take off. It's easy for, you know, when I have to check my drains and do anything like that, use the bathroom, whatever it is, it's easy to pull up and pull off, right? One of the good things about that facility is they're not, you know, providing things and charging you a whole deal of money for it. I actually asked if I can buy these items off of Amazon, and she said yes. So the items I'm going to buy off of Amazon would be my compression garment. So they would get me one, right? But I obviously have to get another one, because the one that they're going to wrap me in is going to have blood and, scar tissue and whatever on it. It's going to get gross. You don't want to keep that on for the duration of your healing time. So I'm definitely going to get another one. Like I mentioned much earlier in the video, I'm going to get one where it covers the bust and it gives that added support. So I'm going to get that one, as opposed to the one, though, just like the waist trainer one that she suggested. She did mention 2 things that I would need. It's arnica and bromelain. And these things I can get over the counter, so there's no prescription for that. One of the good things is that you can get arnica with bromelain, or I think vice versa, bromelain with arnica. And this helps with the swelling and some of the pain. So it really helps with the swelling, so it's highly suggested that that purchase is made for the arnica and the bromelain. I am actually going to show you what I got. So if you guys can see this, it's called an incentive spirometer, right? See the marking lines on it? And basically what that is, it helps me to breathe and ensure that my lungs are performing at 100% capacity after surgery. This would help to prevent any type of pneumonia from occurring in my lungs or anything like that, and just making sure that I'm breathing properly. So there's instructions in the packet, the large packet of information I received. It actually just gives all the details on how to use it, what to look for, the results, the expected results, to show that it's working as intended. So there's a lot of reading material for that little device. So let's jump into getting the drains. So obviously with this type of surgery, I'm going to have 2 drains, one on my left side, one on my right side. Basically, the drains are going to ensure that any excess liquid in my body gets drained out. This too also came with a packet just explaining how to take care of the drains, how to make sure that they're positioned properly. There's no tugging on the drain to bust the stitch that they put to secure it, to make sure that it's not busted. Also how to, I believe the tubing, they give, a little extra. So it's, there's a way to kind of fix it, whether it's like, in pants with pockets, or however you're comfortable wearing it, so that you can lay down or you can sit down and it's not going to be, in your way, an obstruction in your way. So I think basically the drains, and someone has to assist you with it. I was told never empty the drains over the toilet, even if it's a clean toilet, because there is bacteria, that, it's in the air, and it could settle on the tip of where the drain is, where you have to open to pour it out. And you really don't want bacteria getting into your bloodstream, because that's a tube that goes, it's in your body, right? So I was told to pour it in a container that I'm never going to use again, and then from that container just pour it into the toilet, right? So that makes sense, at least to me. So the packet that I have just kind of explains all of that as well, how to care for it, how to open it, how to drain it, how to set it back. So again, like I mentioned, a lot of information, a lot of details needed. I did actually go through the packet a little bit, just kind of getting the idea, but my nurse Thelma, she actually went through everything so well, in such great detail, and she didn't make it sound like it was, tedious, or a tedious process to sit and read. And that's what I like about her. She's just, very easygoing. Same deal with my patient coordinator. They're both just very easygoing women, and I feel very comfortable having to have my surgery at this practice, right? Everyone there is so really nice, very cordial, they treat you with respect, and that's what you need. That's what you're looking for. A place where you matter, a place where they don't treat you like, you know, cows at a slaughterhouse, basically. All right, guys. So that is the gist of everything that was covered and my pre-op. I'm so sorry that it took this long to provide this information. I did have the video before, and during editing it got deleted. So mad respect for content creators who have their shit together, right? Alright guys, so if you like the content, obviously subscribe just to, follow me through on my journey with my mommy makeover. I'm so happy you guys are coming along for the ride. My next video, I'm going to talk about my doctor visit with my annual physical and all the lovely things that I had to do. So stay tuned, and thank you so much for watching. Bye.